Namaste, ma'am.
Namaste.
What is voice disorder?
So voice disorder is any pathology which affects the voice box or the larynx, causing a change in the functioning of the vocal cords and leading to an alteration in the voice. That is called as a voice disorder.
Who are the type of people who get this kind of voice disorders?
So because voice is related to the larynx or the vocal cords basically, so people who are in certain professions where there is requirement for continuous and that is prolonged and excessive usage of the vocal cords, such are the people who are prone to voice disorders. For example, there are professional voice users like lecturers, teachers, then singers, motivational speakers, also people who are like salesperson or business people who have to interact with customers and have to use their voice continuously. Politicians who have to speak continuously or speak loudly when they are giving speeches or attending rallies, addressing rallies. So these are the certain groups of people who are prone to the voice disorders.
What are the main causes of voice disorders?
So voice disorders is just a generalized term, but actually there are many causes which can lead to any disease of the vocal cords or the larynx. So most common is voice abuse. That is the commonest cause for voice disorder. So voice abuse means, like I mentioned earlier, that continuous usage of voice for a long duration and speaking in high volume for days together and without much rest and speaking very loudly. So this is called as voice abuse. Certain people use their voice also wrongly, that is their usage of the vocal cords is improper. So that is called as voice abuse. So that is the commonest cause of voice disorder. Other than that, there are certain causes like chronic smoking. So this also, smoke acts as an irritant for the vocal cords and can lead to some infection or inflammation of the vocal cords. So chronic smokers are also prone to voice disorders. Thirdly, which we see in our clinical setup is a condition called as Laryngopharyngeal Reflex. So this reflux condition is basically acidity leading to regurgitation of acid and contents from the esophagus into the larynx, and there is a spillover of the acid onto the vocal cords leading to irritation and inflammation of the vocal cords. So that is laryngopharyngeal reflux. The fourth common cause will be infections of the larynx. It can be acute laryngitis, laryngopharyngitis or chronic laryngitis. This can also lead to voice disorders. The lesser common causes which we see in our practice are some kind of a benign lesion of the vocal cord. For example, vocal cord polyps, vocal nodules, edema of the vocal cords, that is Rinke's edema, then some papules or tumors, benign tumors of the vocal cords, for example, papilloma or verrucous growths. Then very rarely malignancies of the larynx. There can be extrinsic lesions like, for example, thyroid tumors, which can compress the vocal cords or compress the larynx, leading to disorders of the voice. Then the other less common causes are paralysis of the vocal cords. This is the nerve. Vocal cord is supplied by a nerve called as recurrent laryngeal nerve, which is present on both the sides of the larynx. So any disease which causes paralysis or compression and leading to paralysis of the vocal cords can also lead to voice disorder. Then there are certain lesions in the chest, mediastinal tumors or some other condition of the lungs or the mediastinum, which can also compress the recurrent laryngeal nerve, leading to voice disorders. And the last but not the least is laryngotracheal trauma. So any kind of penetrating or blunt trauma to the vocal cords or to the larynx can lead to voice disorders. One more condition which I have to mention here is, which is often not diagnosed unless the person consults an ENT surgeon, is a condition called puberfonia. In this case, the normal changes which occur in the larynx in a normal adolescent boy when he is around 13 to 14 years of age, that is, the voice becomes from soft to gruff and it attains the adult male voice timbre. So that is sometimes lost in certain adolescent boys because of hormonal changes. That is, the normal transformation does not take place and their voice continue to remain high pitch, shrill, almost like a female voice. So that condition is called as puberfonia. So that is also one of the causes for voice disorders.
How do you examine and investigate your cases?
So it depends on the causes. We have to keep these causes in mind. So any patient who comes with a change of voice which is lasting for more than a week and not improving with the normal medication or home remedies should consult an ENT surgeon. So basically when such a patient comes to us, we take a detailed history. We ask them the mode of onset of the voice disorder, like was it sudden or was it gradual, insidious onset, and was it progressive? And then what are the other associated symptoms that the person had, like did he have cold, cough, sore throat, fever, along with the change in the voice, or was it only hoarseness of voice? Then there are some other associated features we ask for, like is there any history of any trauma to the vocal cords, I mean any trauma to the neck, blunt trauma or any other kind of trauma, or did the person suffer from any other kind of infection? So, and then we also ask for other symptoms like difficulty in swallowing, then any breathing difficulty, any noisy breathing or stridor as we call it, such kind of other associated symptoms are present, or is it only hoarseness? So once we ask the detailed history, then we can get an idea whether it is an infectious cause or whether it is some kind of a tumor or some kind of a tumor within the vocal cords or an extrinsic tumor or some kind of a lesion like the nodules or polyps, etc., which may affect the vocal cords. Then we ask for history of any voice abuse, the profession that the person belongs to, then whether there is any history of smoking, any history of acid reflux. So these are the history we ask. Then we do a detailed examination of the throat and do a video laryngoscopy, indirect or a direct laryngoscopy of the vocal cords to see whether there is any infection in the pharynx or larynx. Direct laryngoscopy will reveal to us whether there is any congestion of the vocal cords, any edema, or sometimes there is some localized lesion like a polyp or a nodule of one side or both sides vocal cords, or if there is some kind of a benign mass or some kind of a growth, ulcerative growth, that might indicate that there may be some malignancy of the vocal cords. So that is one thing. And one more thing, we have to consider the age of the patient also. Elderly patients who have a sudden onset of hoarseness of voice and maybe also breathing difficulty, which is progressive, and have a history of smoking, we have to keep malignancy in mind. Whereas if it is young adults, then malignancy is not thought of as a first diagnosis, so we think of infections or some some benign lesion due to voice abuse. So after a laryngoscopy, we will get a fair idea of what could be the problem. Based on that, then we subject the patient to other investigations, like if we also have to rule out thyroid disorders. So hypothyroidism can also lead to edema of the vocal cords, leading to voice disorder or hoarseness. So we have to rule that out by doing a thyroid profile and also complete blood picture, which may show whether there is an infective pathology. Then if needed, then we subject the patient to a CT scan of the larynx, of the neck or mediastinum if we suspect vocal cord paralysis or some kind of there's some suspicious history of trauma to the neck and we want to rule out any injury to the laryngeal framework, or if we think of some mass lesion which is compressing the larynx from outside, for example some esophageal tumor or thyroid tumor. So such patients are subjected to a CT scan, contrast CT scan of the neck. So these are the basic investigations we do, and then once we come to the diagnosis, then the treatment will follow.
Are larynx and vocal cords prone to cancer?
Yes. So basically there are certain group of people who are prone to cancer of the larynx or the vocal cords. The vocal cords is a part of the larynx. There are other structures in the larynx, for example the thyroid, the cricoid cartilages, the false cords, the arytenoids, etc. So but people who are chronic smokers, as I mentioned earlier, then those who have a history of other abuse also, like co-associated conditions like taking alcohol or chewing gutta or pan, those who have a family history of cancer, elderly people. So these are the people who are prone to cancer of the larynx.
What are the kind of treatment you provide to the patients?
So treatment will depend on the cause of the voice disorder, as I mentioned. So suppose it is a infective cause. For example, if it is acute laryngitis or chronic laryngitis. Acute laryngitis, we have to treat the patient with, first and foremost, we have to tell them to control their voice, so give voice rest. So voice rest will be either complete or it will be subjective, depending on what profession. For example, teachers or professional voice users cannot give complete voice rest for long. So we tell them to reduce the usage of the voice in their non-professional time. So we 48 hours of complete voice rest followed by a relative voice rest, where they do not use their voice much, they give rest to it, and they do not speak loudly, they do not talk continuously. And also when they are giving talks or speeches, we tell them to drink water frequently to keep their voice, to keep the vocal cords moist. They ask them to take steam inhalation, and also not to take foods which might lead to infection, for example, cold beverages, avoid citrus food items, etc. And then we give them a course of antibiotics, also antihistamines if we think that it may be associated with an upper respiratory infection. And we tell them to take plenty of hydration, and then we give a course of antihistamines also. And we call the patient after 10 days to 2 weeks for a review. Then we assess the vocal cords and see whether the condition is improving, whether the voice has improved, they've got back their normal voice. And we examine the vocal cords to see whether the congestion or the edema has settled. In that case, the treatment stops there. But in such cases where they are chronic smokers and there is a marginal change in the voice and the congestion of the larynx is improved, but it is not completely reduced, in that case we ask them to give continued voice rest and take steam inhalation, give them antihistamines, and then in some cases, acute cases where there is a lot of edema, we also give them a course of oral steroids, and then we follow up. So, and then in the follow-up, we tell them to maintain their vocal hygiene and take plenty of hydration, steam inhalation, drink, and then not speak loudly. And then also we ask these patients to undergo speech therapy. So in speech therapy, the speech therapist will guide them to use their voice properly and also do some breathing exercises and not strain their voice. So basically there are some people who use their vocal cords in a wrong manner, and that leads to excessive friction of the vocal cords, leading to the edema and the congestion, or sometimes even thickening and fibrosis of the vocal ligaments. So speech therapy will help in such conditions. In cases of puberfonia, where we have diagnosed that there is no other pathology except that it is because of the lack of the normal physiological hormonal change, where their voice is a high-pitched voice, then speech therapy is the modality of treatment for such patients. And speech therapy of 6 months to 1 year will usually improve the voice. And if that fails, then we subject these patients to corrective thyroplastic operation, where the distance in the vocal cords between the anterior commissure and the arytenoids, that distance is reduced and the vocal cords are shortened and relaxed. So that will lead to gruffness and low pitch of the voice. So that can be done surgically if the speech therapy fails. Then there are conditions, for example, vocal cord paralysis. So if it is a unilateral paralysis and the patient does not have any other conditions like choking, like aspiration or difficulty in swallowing, etc., then the speech therapy itself will improve the voice quality, or the vocal cord function may also within 6 months' time recover. Or the vocal cord paralysis may be compensated by the opposite side vocal cord, thereby reducing the phonatory gap, and the person will get back his normal voice in a matter of 6 months. Then there are conditions, for example, tumors. So it may be benign lesions or malignant lesions of the vocal cord. Such cases require surgical management. So the surgery is called as phonosurgery or microlaryngoscopic operation. So when there are polyps of the vocal cord or nodules, or there is edema, Rinke's edema of the vocal cords, or there are initial cancers like stage 1 cancer where there is unilateral vocal cord involvement of less than 5 millimeters. So in such cases, endoscopically, we visualize the larynx under general anesthesia in the operation theatre, and with the help of laser or cold instruments or with coagulation or microdebrider, we can remove the lesions, the pathology which is affecting the vocal cord. So that is called as phonosurgery. Then in such cases where there is vocal cord paralysis and it has not improved naturally and the voice quality is very poor, it's a low volume husky voice, and the patient is also having aspiration during food. So in such cases we do a medialization thyroplastic procedure, or we also do laser surgeries where the vocal cord is pushed medially by certain techniques, which can be endoscopic or externally through the neck. And then there are laser surgeries also, arytenoid reduction, etc., whereby the vocal cord, the paralyzed vocal cord is pushed medially to reduce the glottic chain, and the voice quality improves. Then, of course, there are other conditions like advanced malignancies of the larynx, which require a partial or a total laryngectomy, laryngopharyngectomy also in case the postcricoid is involved. And then there are esophageal tumors or thyroid tumors, malignancies or benign tumors which require a surgery, which will reduce the compression on the vocal cords and restore the voice quality.
How to prevent esophageal cancer, throat cancer and voice disorders?
So, voice disorders, first part I'll tell you is that prevention is like in professional voice users who are prone to voice disorders. They should know that they should use their voice properly, in the sense that they should not speak for prolonged durations in a high volume or a high pitch manner. They should give some rest to their voice. For example, they can use mics to, teachers or lecturers can use mics to explain their lessons. They need not shout all the time. Secondly, they should take sips of water frequently while they are taking their classes, and that will keep the pharynx moist and hydrate the vocal cords. Also, when they have like politicians or lecturers who have given speech for long, then we instruct them to take steam inhalation once they come back. And so that will again improve the hydration of vocal cords, and any kind of a friction or edema or roughness which has been caused due to prolonged voice usage, that can be corrected. And also persons who have undergone a microlaryngoscopic surgery for a nodule or a polyp. So in such cases also, to prevent recurrence, we ask them to follow this vocal hygiene. And there are patients like, for example, those with vocal cord paralysis, etc. Such patients require a prolonged speech therapy in order to gain their voice, normal voice.